Okay. Okay, I think I've got it. So the question was that, so everybody can hear, why do people with multiple sclerosis have chronic pain? Well, that's a big answer. But let's try to simplify it. Multiple sclerosis damages the nervous system, and when the nervous system doesn't work correctly, you have all kinds of musculoskeletal problems and all kinds of other problems that develop. Now, the first cause, multiple sclerosis, damages the nervous system, and our nervous system is not just in control of motor and thinking, but the sensory system. So everything you feel. So when you damage the nervous system right at its core, you're going to have pain. The thalamic system is in charge of pain, and there's all kinds of other nerves and neurons that can also cause pain. For example, you can have neuralgia. One of the most famous causes of neuralgia is trigeminal neuralgia, which is a stabbing pain in the face. This is a cranial nerve that gets damaged from multiple sclerosis. You can have dysthesias, or an uneasy feeling throughout the whole body that feels like a burning, and you can have a pins and needles feeling. You can have a feeling that your things are going to sleep, a numbness, all kinds of nerve-like pains as the thalamic system in the brain and the spinal cord get damaged. So you have a famous sign called Lamberti's sign, which is an electrical shock that goes down your spine when you bend your neck forward. You get all kinds of different strains, sensations, and pains from the damage to the nervous system. Okay? You also have pain of spasticity. The muscles don't work correctly. It's complicated why spasticity develops because the motor system's damaged, the system that tells the body what to do. It also has to do with other things, but basically the muscles become severely spasmed, and they can be really severe. And this damage to the central nervous system and the spinal cord leads to that spasticity. And this spasticity can lead to further problems, other skeletal and muscle pain, back pain. The spasticity, the immobility, and the nerve pain can lead to decreased activation, which can cause increased pressure on certain parts of the body, like the buttocks and the back, because you might be laying in one position for a while, you might be sitting in your wheelchair for a while. That can cause pain. Also, the spasticity and immobility and strength problems can cause you to struggle and to compensate for your gait, your walking, compensate for balance. This can cause increased joint problems and joint injury, and of course there's falls. And because you may not feel your feet, you might step on things and injure the foot, and that leads to infection and further pain. So there's all kinds of things, from damaging the central nervous system, damaging the sensory system, damaging the motor system, damaging the gait, the ability to walk, the balance system, the knowing where your joints are. All kinds of things can come that can lead to pain. And of course, when you're in this kind of condition, just the normal pains of life can be accelerated and aggravated very easily. You have increased joint stiffness, increased joint pain. You can't compensate as well. You can't activate as well. And then on top of all that, there can be some depression because of the disability. And there's fatigue that comes with the disease, which further aggravates the pain. There can be insomnia, and there can be thinking problems that aggravate the pain. All these kind of things that can trigger or aggravate pain also exist as part of the disease process. Now, that answers the question, why? And we do a whole tract on treating multiple sclerosis pain, some opportunities and some options on the mychronicpain.com site. It should be up in mid-November. And We also have on the free membership site on mychronicpain.com a thing that goes over therapy and neuropathic pain seminar, and we do talk about some of the therapies. We don't talk a lot about the antispasticity medicines like baclofen and Xanaflex, etc., but we do talk about that in the multiple sclerosis track. So I hope that answers the questions. We are having a seminar on multiple sclerosis in December, a teleseminar. So hopefully uh, you're a caregiver, right? Yeah. Hopefully you can get you and your person you care for can listen in. I hope that's the question. Thanks.